Hello and welcome to Pharmacomania. I'm Dr. Shahnaz Malik and we are going to discuss factor modifying drug action. And material of this lecture is taken from Standard Book of Pharmacology as well as Medicine. Responses variation to a drug, like person to person variation, as well as same person is taking medicine on different occasions, so response may be differ. So individual differ in pharmacokinetic handling of drugs, like varying plasma or target site concentration or metabolizing drug versus excreted unchanged drugs. Example is propranolol and atenolol. Both are beta blocker, but its responses are differ. Categories of factors are genetic factor and non-genetic factor. Non-genetic factor including environmental factor, circumstantial factor and personal variables. Now, factor modifying drug actions are qualitatively action and quantitatively action. So, quantitatively actions are like plasma concentration at the site of action can increase or decrease the reaction, or qualitative response is the drug alter the response like allergic reaction and idiosyncratic reaction in a patient. Now, factors affecting drug actions are number of factors which can influence the response of the drug. First is the patient factor and another one is the drugs factor. So, in patient factor, age of patient, body weight, gender, environmental factor, genetic factor, psychological factor, pathological state, tolerance and dependence. All these factors are depend on the patient's. These are the patient's factor. Another one is the drugs factor, which include route of drug administration, presence of other drug and accumulation. These are drugs factor. We'll see in brief all these factors. Age is important factor in patient factor. In neonates, the metabolizing function of liver and excretory function of kidney are not fully developed. Drug like chloramphenicol, which is antibiotic, causes gray baby syndrome due to metabolizing enzyme are not fully developed. And another example is low glomerular filtration rate and tubular transport of the gentamicin and penicillin. So, increase the retention of gentamicin and penicillin in the body causes more toxicity can occur due to above drug. So, in this condition, we have to reduce the dose of the drug. Another example is blood-brain barrier is not more permeable, so increased permeability of unconjugated bilirubin and kernicterus can occur in neonate. Absorption of drugs alter due to lower gastric acidity and slower intestinal transit. Faster transdermal absorption and faster rectal absorption of the diazepam in children. After 1 year, faster metabolism than the adult in some drug like phenytoin, theophylline, carbamazepine due to primarily excreted unchanged by kidney. In adult, penicillin G is given 6 hourly, when in infant it is given 12 hourly, is that the excretory function is not completely developed in children. Adverse effect of the drugs in children. Suppression of growth can occur due to corticosteroids. Androgen may promote early fusion of epiphysis, resulting in stunting of stature. Tetracycline get deposited in growing teeth and discoloration of it. And dystonic reaction occur due to phenothiazide. In elderly patients, pharmacokinetic changes are like slower absorption due to reduced gastric motility and blood flow to intestine, lesser plasma protein binding due to low plasma albumin, and increase or decrease volume of distribution of lipophilic and hydrophilic drug respectively. In the elderly, renal and hepatic function are progressively decline. The incidences of adverse effect of the drug relatively more, and drug doses have to be reduced accordingly. Examples are dose of aminoglycoside is less than normal adult dose. Aged are relatively intolerant to digitalis. The responsiveness of beta adrenergic receptor to both agonist as well as antagonist is reduced. Due to prostatitis in elderly male, anticholinergic activity of the drug causes bladder voiding become difficult. Elderly are likely on the polypharmacy for hypertension, ischemic heart disease, diabetes, arthritis, which can increase the chances of drug interaction. Second factor is body weight and body surface area. Body size influence the concentration of the drug attained at the site of action. The average adult dose referred to individual of medium build. For exceptionally obese or lean individual and for children, dose may be calculated on the basis of body weight. A more accurate method of calculation of dose is on the basis of body surface area of the patient, but it is useful in anti-cancer chemotherapy and some handful drug. There are some formulas to calculate dose on the basis of age. First is the Young's formula. It assumes that a child 12-year-old should be given half of the adult dose. Like amoxicillin, dose of amoxicillin of adult is 500 milligram, and for the child, formula is age in year divided by age plus 12 into adult dose. So 12 is the age of child and 500 milligram is the adult dose, divided by age is the 12 plus 12 equal to 250 milligram. It is the half of the adult dose. Second is Dilling's formula. It is presumed that 20 years old adult should be given adult dose. Formula is child's dose equal to age in year divided by 20 into adult dose. So age is 20, 20 into 500 milligram is adult dose, divided by 20 equal to 500 milligram. It is equal to adult dose. Now dose calculation on the basis of body surface area. The body surface area is better index because it based on the both height and weight. Formula is body surface area into adult dose divided by 1.73. It is useful in anti-cancer drug as well as some handful drugs. Sex or gender. Females have smaller body size, so it required lower doses. Digoxin in maintenance therapy of heart failure mortality is higher in women. Beta blocker, methyl dopa and diuretic can cause sexual dysfunction in males. Gynecomastia can occur due to metoclopramide, chlorpromazine and ketoconazole in males. Ketoconazole causes loss of libido in male but not in female. 6. There are marked and progressive physiological changes during pregnancy, especially in third trimester, which can alter the drug disposition. Gastrointestinal motility is reduced, delayed absorption of the oral administered drug. Plasma and extracellular fluid volume expand and volume of drug distribution may increase. When plasma albumin level falls, alpha-1 acid glycoprotein increase and unbound fraction of acetic drug increase and basic drug decreases. Renal blood flow increase, marked polar drug are eliminated faster, and hepatic microsomal enzyme undergoes induced induction and made drugs are metabolized faster. Overall effect on the drug deposition is complex and often difficult to predict. Species and races. Species variation in drugs response. Some strain of rabbit resist to atropine. Rats and mice are resistant to digitalis. Rats are more sensitive to curare than cat. Race. Racial differences have been observed. Blacks require higher doses of atropine and ephedrine to dilate pupil, while Mongols required lower doses. In Africans, beta blockers are less effective as an antihypertensive drug. Now, genetic factor. Pharmacogenomic is use of the genetic information to guide the choice of drug and dose on individual basis. Atypical pseudocholinesterase resulting in prolonged succinylcholine apnea. G6PD deficiency is responsible for the hemolysis with primaquine, chloroquine, quinine, dapsone and aspirin. Low activity of CYP2C9 enzyme variant metabolize of warfarin at the slower rate and are higher risk of the bleeding. Malignant hyperthermia after halothane is due to abnormal calcium release channel. It is the ryanodine receptor in the sarcoplasmic reticulum of the skeletal muscle. Now, psychological factor, efficacy of drug can be affected by the patient's belief, attitude and expectations. Personality of doctor also affect the response of the drug to the patient. Some patient responds to inert dosage form like placebo in condition like pain, bronchial asthma and anxiety. Now placebo. So placebo is inert substance which is given in the garb of the medicine. Placebo is a Latin word and it means I will please. It is tummy medicine and having no pharmacological activity. It is used in the relief of subjective symptoms like anxiety, headache, tremor, pain and insomnia. It is also useful in clinical trial in order to minimize bias. Placebo effect. Placebos induces physiological response. They can release endorphin in brain causing analgesic effect. Naloxone is an opioid antagonist and block the placebo analgesic effect. The effect produced by placebo is called placebo effect and substance commonly used as a placebo are lactose tablet and capsule, distilled water and injection. Multivitamin preparation are often misused as a placebo when no medicine are indicated. Nocebo. It is converse of placebo and refer to negative psychodynamic effect evoked by pessimistic attitude of patient or by loss of faith in medication or in physician. Nocebo effect can oppose the therapeutic effect of active medication. Factors affecting placebo effects are patient factor like patient with neurotic symptom often respond to placebo. A drug factor like physical presentation of the drug and route of drug administration like colorful tablet like red, green, blue tablet and injectable preparation are better placebo effect. And doctor factor like personality of doctor, motivational way of instruction, doctor patient relationship, these all are factor which causes increase the response of placebo. Now drugs factor. Route of drug administration. When a drug is administered by different route, it commonly exhibit qualitative as well as quantitative variation. Quantitative variation like oral dose of drug are usually longer than intravenous dose. Since intravenous route of drug administration produces 100% bioavailability. For analgesic effect, intravenous dose of morphine is 5 to 10 mg when oral dose is 30 to 60 mg. Onset of drug action following intravenous administration is rapid because drug is directly reaches into the systemic circulation. Qualitative variation, the drug may produce an entirely different response when administered by different route. Example is magnesium sulfate, which can administered orally produces purgative effect. When magnesium sulfate introduced parenterally, it causes CNS depression, so it can be used in eclampsia. And on the local application reduces edema and inflammation of the swelling. Presence of other drug, it may causes increase the effect of the other drug or antagonize or it inhibit the effect of another drug. So it can cause additive potentiation, synergism or antagonism of another drug. Now accumulation. Any drug which accumulate in the body if rate of administration is more than the rate of elimination. Slowly eliminated drugs are particularly liable to cause cumulative toxicity like prolonged use of chloroquine can cause retinal damage and full loading dose of digoxin should not be given if the patient is received it within past week. The course of imetin should not be repeated within 6 weeks. Diet and environmental factors. Milk reduces absorption of tetracycline. Fatty milk increases absorption of cryptophyllin. Cigarette smoking induces hepatic microsomal enzyme and increased metabolism of drugs such as theophylline. So the dose of drug administered may be inadequate for the smoker. So theophylline dose should be increased in cigarette smokers. And exposure to insecticide or carcinogen like tobacco smoking and consumption of charcoal broiled meat are well known to induce drug metabolism. So in this condition, we have to increase the dose of the drug in smoker or in these conditions. Hypnotics taken at night and in quiet and familiar surrounding may work more easily. Statins can cause greater inhibition of cholesterol synthesis when it is taken in the late evening. Corticosteroid taken as a single morning dose causes less pituitary adrenal suppression. Pathological state like gastrointestinal disorder like celiac diseases. In this condition, amoxicillin absorption is decreased while cephalexin and cotrimoxazole absorption is increased. In achlorhydria reduces absorption of aspirin. Non-steroidal anti-inflammatory drug aggravate the peptic ulcer. Gastric stasis occurring during the migraine attack retard the absorption of ingested drugs. Liver diseases influence the drug action are like metabolism of drug reduces and increased bioavailability of drug. Serum albumin reduces protein bound acidic drug like warfarin free drug are available more, so increase the chances of toxicity and bleeding tendency. Metabolism and elimination of drug may reduces, so dose should be reduced like morphine, propranolol and lignocaine. Pro-drug required hepatic metabolism for active formation. So it is less effective in liver diseases. In kidney diseases, pharmacokinetic of many drugs are affected. Clearance of drug is in unchanged form reduces and parallel to decreased clearance. Drugs like aminoglycoside, digoxin and phenobarbital. Loading dose are not altered but maintenance dose should be reduces. Plasma protein albumin reduces binding of acidic drug is reduced. Permeability of blood-brain barrier increase. Barbiturate opiate more CNS repression can occur due to increased permeability. Drug acting via kidney mechanism become ineffective by decreased glomerular filtration rate of thiazide and urinary antiseptics. In congestive cardiac failure, decrease the drug absorption from gastrointestinal tract due to mucosal edema and splenic vasoconstriction. A significant reduction in procainamide and hydrochlorothiazide absorption from gastrointestinal tract. Altering volume of distribution which can increase for some drug due to expansion of extracellular fluid volume and decrease for other as a result of decreased tissue perfusion. For example, loading dose of drug like the lidocaine and procainamide should be lowered. In CHF, retarding drug elimination as a result of decreased perfusion and congestion of liver, reduces glomerular filtration rate and increased tubular reabsorption. Dosing rate of drug may need reduction and as for the lidocaine and procainamide and theophylline. The decompensated heart is more sensitive to digitalis action. In thyroid disease, hypothyroidism patients are more sensitive to digoxin and hyperthyroid patients are relatively resistant to inotropic action of digoxin but more prone to arrhythmogenic action. The clearance of digoxin is roughly proportional to thyroid function. Other examples are like antipyretic lower the body temperature when it is raised, and thiazide induces more marked diuresis in edematous patients, and myocardial infarction patients are more prone to adrenaline and digitalis induced cardiac arrhythmias. Other examples, myasthenic patients are very sensitive to curare. In them weakness is aggravated by quinine. Schizophrenic tolerant to large doses of phenothiazine. Head injury patients are prone to go into the respiratory failure in normal doses of morphine. Atropine, tetracycline, antidepressant and furosemide can cause urinary retention in individuals with prostatic hypertrophy. Hypnotic given to a patient in severe pain may cause mental confusion and delirium. Cotrimoxazole produces a higher incidence of adverse reaction in AIDS patient. Tolerance. So what is tolerance? Tolerance is the need of larger dose of drug to produce given response. Tolerance developed to nasal decongestant effect of ephedrine on repeated use. Patient on organic nitrate for angina develop tolerance on the longer therapy. Sulfonylureas in type 2 diabetes also develop tolerance. Beta 2 agonist in bronchial asthma causes tolerance development, and tolerance is commonly seen with drugs like morphine, alcohol and amphetamine. Now, type of tolerance. There are two type of tolerance: natural tolerance and acquired tolerance. Natural tolerance is patient are or subject are genetically determined or reduce lack of response to particular drug. Like there are two types: species tolerance and race cell tolerance. Species tolerance: some species are tolerant to certain drug, like rabbit can tolerate larger dose of atropine. When race cell tolerance: some races slow tolerance to certain drug, like black people are tolerant to mydriatic. And acquired tolerance, it develop on the repeated exposure to a particular drug, like sometime tolerance develop only a certain effect. On repeated use of morphine, tolerance develop to its euphoriant effect but not its miotic effect. Mechanism of development of tolerance. There are two type of mechanism: pharmacokinetic tolerance and pharmacodynamic tolerance. So first of all, pharmacokinetic tolerance is dispositional tolerance. It is due to reduced concentration of drug at the site of action. It may result decrease absorption or increase metabolism or excretion. So example is rifampicin induces metabolism of enzyme and causes oral contraception. Oral contraceptive pills enhance their metabolism, leading to contraceptive failure. Pharmacodynamic tolerance is a functional tolerance, and drug effect is reduces, which may be due to downregulation of receptor or decrease the receptor coupling signal transduction. On repeated use of opioid, barbiturate can cause result in development of tolerance due to decrease in number of receptor. It's called downregulation of receptors. Cross tolerance is the phenomena where tolerance exhibited by closely related drug is called cross tolerance. Among nitrates, opioids and between ether and alcohol, cross tolerance can occur. Now, tachyphylaxis. Tachyphylaxis is the repeated use of certain drug at short interval may result in rapid development of tolerance, or rapid decrease in pharmacological response is known as tachyphylaxis or acute tolerance. Drugs are tyramine, ephedrine and amphetamine can cause tachyphylaxis. These drugs act by releasing norepinephrine from the adrenergic nerve terminal, and repeated administration of drug can cause gradually depletion of the neurotransmitter and reduction in the response. Drug dependence. According to World Health Organization, drug dependence is a state of psychic and sometimes physical resulting from interaction between living organism and drug interaction, characterized by behavioral and other response to that always include compulsion to take drug on continuous or periodic basis in order to experience psychic effect and sometimes to avoid discomfort of absence of drug. Drugs are opioid, alcohol, barbiturate and amphetamine, which can cause drug dependence. Thank you for watching the video. Please like, share and subscribe the channel.